Hello everyone, this is question 44 of our 100 clinically oriented anatomy questions. So let's jump straight into it. The question says, an 82-year-old grandmother slipped on the polished floor in her front door and was transported to the emergency department and admitted for examination with a complaint of great pain in her right lower limb. During physical examination, it is observed by the resident that the right lower limb is laterally rotated and noticeably shorter than her left limb. Radiographic examination reveals an intracapsular fracture of the femoral neck. Each of the following artery supplies the head of the femur in early childhood, but no longer in a patient of this age. Superior gluteal artery, lateral circumflex femoral artery, the branch of the obturator artery, inferior gluteal artery, and the internal pudendal artery. So all these stories are not what we are interested in. The question is basically asking us that okay, there was an intracapsular fracture of the femoral neck. And we know that intracapsular fracture results into a vascular necrosis. Vascular necrosis is basically the when the cells of that particular region dies because they are not getting enough blood supply. That's basically what a vascular necrosis is. But then the question did not even ask us that which artery will be affected in an intracapsular fracture of the femoral neck. It is telling us that which artery basically supplies the head of femur in childhood but does not support it in adults. That is a very straightforward answer. The answer is the obturator artery. So the obturator artery, a branch of the obturator artery, is the major blood supply to the head and the neck of the femur in childhood, up to 6 years of age, 8 years of age. You still have the obturator artery present. But then when the person comes of age, the artery becomes atretic, and then the other arteries, of course, take charge of that supply. Although the obturator artery is actually still present in adults, but it supplies that area of the fovea capitis. That fovea capitis, that is the only region it supplies in adults. All right. So the major blood supply to the head and neck of the femur in adults an 82-year-old adult is the retinacular branches of the lateral circumflex and the medial circumflex femoral artery. All right. Those are the two major blood supply um, to the head and the neck of femur. You have other blood supply. The superior gluteal nerve also gives a tweak to the hip joint. Inferior gluteal nerve gives a tweak to the hip joint also. Although those ones are in adults, not in younger ones. So the correct answer to the question is option C, which is a branch of the obturator artery. And as regards the option E, internal pudendal artery, that is a branch of the internal iliac artery that gives blood supply to the perineal area. So that's basically the cause of the internal pudendal artery. So the correct answer is option C. I believe you understand that, you gained from this video and you enjoyed the video. And I'll see you in the next episode. Thank you.